Hello, this is your Louisiana chiropractor, Dr. Eric Prather, coming to you from Prather Chiropractic Services in Lafayette, Louisiana. Today we have here with us Will, who came in just for a regular checkup. He came in with no symptoms whatsoever, 21 years of age, and he saw us on YouTube, saw some videos, was curious about chiropractic. He's like, you know what, that looks like a good idea. Before I have problems, I want to come in and get my spine checked. So we went through his history, exam, and x-rays, and Will's a very interesting case because even though he doesn't have any symptoms, we found a very significant finding in his cervical x-ray. So if you can zoom in here pretty close, Meg. What I was explaining to Will is that in his cervical spine, he has a situation called a cervical kyphosis. That is a reversal of the normal curvature in the neck. This white line represents how the attitude of his cervical spine should look. And we can see from here, if we look at the vertebral bodies, his cervical spine is actually bent forward. And we refer to that as a kyphotic or military neck. This is usually the result of some sort of hyperflexion, hyperextension injury, like whiplash or collisions in sports, falling out of a tree, where the head is flexed forward or flexed backward very violently. And it does damage to the ligaments in the neck. Specifically in his case, there's a ligament that runs down the back of the vertebral bodies called the PLL, the posterior longitudinal ligament. You have another ligament in the front of the vertebral bodies called the ALL, anterior longitudinal ligament. Now when the head gets snapped violently forward and backwards, you're gonna get an elongation, sometimes a tear or even a complete rupture of that ligament, and you better believe you're gonna have problems with joint motion thereafter. So it's really good that we caught this early at 21 years old, because even though he's not having any symptoms, this area is ripe for further disc injury and degenerative joint disease, degenerative disc disease, osteoarthritis of the spine, etc. So with chiropractic care, we can help maintain proper joint motion, or at least try to get some of it back, and hopefully prevent that from degenerating long term. Digging a little bit more into Will's history, we discovered that, you've got to put in your notes, right? We discovered that, oh, I used to do gymnastics. So he's like, yeah, he would always land on his head when he was trying to learn how to do double back flips and flip flops. And yeah, I mean, that's, you know, in 21 years of practice, I've seen a lot of athletes, a lot of high school athletes come in for one reason or another. And, you know, certainly things like the most obvious ones, you know, hockey or football, you expect injuries with those, you know, knee injuries, etc., or, you know, head trauma. But, you know, as far as objective findings, like what I'm feeling and what I'm dealing with when I'm working on the patients, by far and away, gymnasts have the most beat up spines, by far. And I can tell that from working on them. It may not look bad, you know, you look at a gymnast and they're incredibly fit. It's like you think that person's super in shape. Well, they're in shape, but they're damaged too, they're injured. So very taxing. Parents, if you have little ones in gymnastics or acrobats or cheerleading or tumbling, etc., watch for those spinal injuries, because it will leave a lasting footprint on the spine that you'll have to deal with for years to come, even though they may not be having any symptoms now. Get the spines checked. So it's good that you're in here. It's good that you're in here. But we'll be able to help you with this and keep that from degenerating further, because you got a long way to go. 21 years old. That spine's got to last you another 90 years, 100 years, you know. All right, you got any questions for me about this, Will, before we get started? Okay, so we talked about doing an adjustment. The purpose of an adjustment is to restore proper joint motion. So we're going to get into that right now, okay? Let's have you go face down on this table for me. There you go. Okay, there you go. Hands on the side right here. Well, let's slide you down some. There you go. All right, nice and relaxed. Check your leg length. Get your legs real loose for me. Now he's a little short on the left. Let your knees bend up. And he gets long on the left. So that is a positive Deerfield. Let him bend all the way. Oh, you got some tightness in those quads too.
Oh, yeah.
Yeah, that's real tight. You do any stretching?
No.
Not as much as you should, huh?
Yeah, no.
Any tenderness in the lower back when we do this, or in the pelvis?
I mean, I just feel pressure.
Yeah, just some pressure.
Yeah.
But you definitely tighten those thighs.
Yeah,
All right.
my hamstring.
Okay.
Yeah.
Any sensitivity or tenderness in here?
No,
All right, that's a little bit fixated on this right side. Couple of pockets of inflammation, hypertonicity. See, like that right there? That's tender. That's got a big pocket of swelling inside that joint. And I'm sure you can feel that when I push, how it's different from this one. All right, man, we're gonna get into it here. You're gonna feel the table jump up, start your adjustment. Good. There we go, big release. Good movement. Let those shoulders roll forward just like that. Okay, he's got some hypertonicity on that right side and a little bit of rib humping, so you can tell he was beat up back in the day. All right, you can feel the headpiece jump. Now we see we're working on that curve, pushing that curve back in that neck. Okay, roll it on over for me, Will. There we go. Just flat on your back. Now we're going to bring that head back over the shoulders, put the hands in the tummy, just like that. Good. Now, Will's never had chiropractic care, so this is the very first adjustment ever. Let your arms go out like this.
This is my favorite part, Will.
That's good. Gravity's constantly pulling us forward, so this helps push back on gravity. Okay, hands on the stomach again. All right, now we're going to decompress your hip and knee. All right. Just let that leg dangle. Oh, good release there. Should have felt that go all the way up.
Oh yeah.
Okay, let it dangle. All right, there we go. I'm sure you felt that ankle pop too with it.
That ankle pop too.
Come over here, spin to the side here. I'm gonna work on the upper extremities. Okay, let that arm. That's a good release there. So every time we do this adjustment, these adjustments, we're releasing the pressure in the joint, all right? That makes it feel better. Look at that. And there's nerve endings inside the joint that communicate with the brain. And then your brain communicates with the joint through those same nerve endings. Not too bad. All right, so far so good?
Yeah.
All right, probably feels better already, huh?
Feels better,
Yeah,
honestly.
yeah. All right, so now we're gonna decompress. We've been adjusting on a couple of different planes, and now we're gonna do the decompression procedure.
All right, let's do it.
All right, sir. Have a seat right here, then lay flat on your back for me. Okay, we're gonna slide you down. Okay, now to do this procedure, we want to put the spine in a neutral position. So we're going to elevate the legs to accomplish that. So just dead leg it. Keep your legs nice and loose. All right, that's pretty good height there. Right here. That's it. All right, now to keep you from sliding, we're going to pin you to the table. Stabilize. It's going to be a tight squeeze here.
Yeah.
Tight, huh? You're not going anywhere.
Yeah, no.
Just a little bit there. All right, just let it settle. Just let your body settle into that position. Okay.
Hit it for me a little bit.
Now you've seen this done before,
Yeah.
right? The ring dinger.
The ring thing.
Back teeth touching, Will, breathing through your nose.
Back teeth touch and breathe through my nose.
That's it. Wiggle your third toe. Breathe, 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 man. You hit that one pretty good.
Yeah, that one hit.
How far down did you feel that?
Honestly, probably.
Yeah?
To right there.
About right there?
Yeah.
Okay. So second and third, we tend to get a little bit deeper on the adjustment, but you know, they're pretty intense. Pretty intense.
Yeah.
You have a lot of damage in that neck, so we didn't go absolutely full tilt on you yet, but that's gonna come on your subsequent visits. All right, very good, very good. Tolerated pretty good.
Okay.
Those legs down. Okay, go ahead and come up for me. Yeah, that's it, just move this way. All right, you feel okay?
Yeah, bro.
Pretty good start, pretty good start.
Solid.
All right, you got any questions for me?
I think that's about good.
All right, we'll probably do, you know, a small series of treatments close together till we get that spine fully cleared out. Normal routine in the beginning, 4 to 6 adjustments close together. And if we accomplish what we need to, then we'll put you on a regular follow-up maintenance plan.
Yeah, sounds like a good.
All right, any questions? No questions? You might be sore. You might be sore, so use some ice. Use some ice, use some stretching. How do you ice? Ziploc bag, put some crushed ice in it, put on the sore spots. 30 minutes on, off for an hour.
Okay.
All right, good deal?
Yeah, I'm good.
He's Louisiana chiropractor, Dr. Eric Prather. We'll see you soon.